If there is one conversation that we've all had very frequently over the last couple of years, it is the great thanks we have to our medical community and the advances that they're making all the time in medical research and technology. That is true for almost any field of medicine, but certainly when it comes to orthopedics. Dr. Tim Ballard joins us this morning. He is a total joint replacement surgeon with the Center for Sports Medicine here in town. If I didn't get that quite right, main thing to know is if you've got hip pain, knee pain, he is your man who can help you. So good morning, Dr. Ballard.
Hey, good morning, Julian. You nailed it. I am Tim Ballard from the Center for Sports Medicine and Orthopedics, and I specialize in adult hip and knee reconstruction.
So the thing that people need to remember, I guess, is that very frequently these really do go hand in hand, or hip and knee. I mean, your leg is completely meant to connect one part to another. So if your knee is not aligned properly, you could end up having problems with your hip later on. Is that fair?
Sure, absolutely. And I'll tell you, for me, of course, I look at the global patient when you come in with concerns, but it's impossible for me to adequately evaluate hip or knee problems without looking at the other joint. So, for instance, I see a lot of people with a particular hip problem that come in typically with knee pain, and vice versa. You can have knee pain that's coming from your hip because one's at one end of your femur or thigh bone and the other's at the other end of your femur or thigh bone. So I definitely look at them both together.
And I guess that's something for the patient to remember when they're coming into your office, and why you're so thorough in asking questions that might not seem relevant to the unskilled ear, because you have to really know where their pain is. You have to watch them walk. You have to examine a lot more than what they're just telling you to find the source of the problem.
That's absolutely true. And along those same lines, though, I always say in orthopedics that usually if you'll listen to the patient, within about 60 seconds, they'll tell you what the problem is.
Okay, now I mentioned the advances in medical research and technology. So once upon a time, not too long ago, if you heard about somebody having a total hip replacement, you would just wince in fear for that person. Those days are gone. People recover quickly.
Oh yeah, Julie, I agree with that completely. So first, let me step back and just give us sort of a basic foundation of what we're talking about with hip and knee replacement. So your knee, for instance, is made up of the end of your thigh bone or femur and the top of your tibia or your shin bone, and those bones come together. There's cartilage, like the gristle on the end of a chicken bone. Similarly, on your hip's a ball and socket joint. Those two bones come together, there's cartilage there as well. And that cartilage doesn't show up on x-ray. So I can see a dark space between the bones on just a regular plain x-ray. When that dark space is gone and you're rubbing bone on bone, the only way to fix that problem is to put new surfaces on the ends of the bones. Surely at early stages, an anti-inflammatory medication, an injection, certain situations, a brace, occasionally even physical therapy may take the edge off a little bit, but when you get past all those non-operative treatments and need something done surgically, a hip or a knee replacement is basically putting new surfaces on the ends of the bones. And some of the exciting advancements that have occurred include design things. So our knees and hips now, we're hoping, are going to be 30-year joints. So when I started doing this a quarter of a century ago, you hope that somebody got 10, 15 years out of something, and so you tried to hold them off on surgery till they got later in life. Now, with the advanced longevity of these components, it's something we can offer to a younger and younger population. So you don't have to waste your 30s and 40s, for instance. Even if you're a young person with a joint that's completely worn out, you can get that fixed and get back to moving. The other thing that's exciting now is these joints are so stable and durable that I let people do advanced activities. So I have a guy that's a karate instructor. I have a guy that's won multiple Ironman competitions and travels around the world. I have a guy that's a tennis instructor. I can go on and on with different things. Plus, I've had women with hip replacements that had babies afterwards. So they don't stop your life. They let you get back to life. Now, one of the other big improvements that's happened for us is how quickly people recover from these things. As you touched on, when I was a resident 100 years ago, longer than I did, we typically had people in the hospital for 7 or 8 days. Then when I got into practice here in the late 90s, we were happy to get under the 4-day mark. It was a big trick when our length of stay got less than 4 days. Now, routinely, my folks go home from the hospital in less than 24 hours, and I'll probably have half of them that go home the same day. And that's really exciting, and that's a collaborative effort, not only between surgical techniques, but also physical therapy and our colleagues in anesthesia. So my anesthesiology colleagues now do all kinds of certain blocks and different techniques to help you with pain control and help you get back to activity quickly. So probably half of my folks have surgery that they don't even go to sleep for it now. And we get you up walking right away because before I let you go home, you have to be able to get in and out of the bed, on and off the toilet, up and down a few stairs, and walk about 400 feet. And what's really remarkable about that is about half of my folks are doing that the same day and going home with a new hip or a new knee. So it's all very exciting.
You've got a lot of people out there who are kicking their legs right now at the idea of being able to have that kind of good news from you. We have less than a minute left. Is the best thing for people to do call the office? You have so many surgeons there. Should they ask for you specifically, or when they call and describe their pain, they'll be assigned the correct surgeon for them?
Of course, I'm always honored to have somebody call and ask for me, but if you call 423-624-2696 at our Center for Sports Medicine Orthopedics, they will help direct you the right way. So whereas I'm a hip and knee reconstruction specialist, we have specialists in every area of the musculoskeletal system, be that spine, foot and ankle, hand, upper extremity, shoulder, sports medicine. You don't have to know who to ask for. If you call the desk, we'll point you the right direction.
And I'm going to give you a big pat on the back for the final words, because he was late to the interview this morning because he was in surgery and stepped out to find a few minutes to call us. So thank you so much, Dr. Ballard.
Thank you so much, Julie. It's my privilege to talk to you. Have a great day.
You too.